Many autistic people do not present in this stereotypical way. Very often these are females, non-binary people, and often some young males as well. They may have superficially very good eye contact. They may be very good at maintaining a conversation. It's particularly the case that schools will often report that young people are fine in school, and therefore the problem must be something around the parenting or the home environment, when in fact many young people work very, very hard to hold it together basically whilst they're in school. And then all the anxiety and stress comes out when they're at home, and that's when their true self and the nature of their challenges becomes more obvious.
Masking can be an autistic patient going to see their GP and preparing everything they're going to say to their GP before they get there. And then if the GP doesn't fit that script, then that throws them, and they might miss the most important piece of information, which is the main issue that they've gone to their GP for in the beginning.
I think one thing to be aware of as well, and I don't know whether it's part of the masking process or not, but it's in a wider context, I call it my spreadsheet. So as part of appearing normal, then I have certain responses to certain situations that I look up and have the right response. And this is what I do in any interaction with anybody of any officialness. Then I will rehearse what I'm going to say. I will anticipate the possible path through that conversation and rehearse all the answers that I'm going to give. And the problem is when something appears on the spreadsheet or appears in that rehearsal that is off script, that's when I become autistic, and my responses can maybe appear rude or odd or anything like that. It will raise alarm bells with anybody who's actually kind of paying attention. But it's part of life, and I actually believe that everybody did it. And it's only in later life that I realized that people don't, and that this is why any social interaction is so stressful for me, because I'm constantly going through this. This is the situation on the spreadsheet. This is the correct response I need to give. This is the situation. This is the correct response. And I'm doing that all the time. I'm rehearsing in my own head every piece of interaction, making sure that it doesn't sound rude or making sure it doesn't sound aggressive or whatever, so that I'll give the game away and appear not normal.
We also need to be aware that people are very good at masking these symptoms. The reason is that they had managed to cope all these years by masking the symptoms, and they think it's very normal to do that. For example, we can see that there are boys that has been labeled as quiet because they do not cause any problems. They just do what they have been asked to. They isolate themselves from any trouble because they cannot identify with the rest of the people in their classes or in their workplace. And then often girls who are very quiet because they do not often present with challenging behaviors. There are certain subtle signs that we need to be aware in our colleagues as well, because these might be people who have missed a diagnosis and have missed many opportunities in their life because nobody was able to let them know what help they can access. We need to be careful about understanding what their normal behavior is, or is it a bit more of a neurodivergent behavior. We can ask them to be aware of their routines and rituals, their ability to sort of cope with stress, their ability to manage transitions. And there are certain behaviors that are subtle, but I'm sure we all manage to notice it on a day-to-day basis. One of them is that they tend to mimic other people's behaviors and try to blend in and be part of the group. There are certain words and conversations that they often use, they pre-prepare so that it comes naturally to them, because they really lack instinctive reactions. They also imitate gestures, expressions, and behaviors which they want to adapt. We also find them having very intense interests, very specialist interests with regards to people, music, animals, and they can talk about it anytime to anyone without really understanding whether the other person is interested in it. The friendships are often one-sided, and we often tend to see that the friend is often a motherly type or tender, sort of nurturing character. There are words that might make us think that these people are neurodivergent. For example, they refer themselves as quiet and shy, daydreamers, quirky behaviors, fidgety and fussy eaters.
So another reason why my daughter was not initially put on the autistic pathway was because she had a brother who was also attending CAMS, and he was on that pathway because he presented incredibly differently. He's a male. He has a much more stereotypical presentation of autism. And the psychiatrist actually wrote in a report stating that she didn't need to be on the autistic pathway because she didn't present in the same way as her brother. And once again, that was another big tick against what happened in future months and years before she actually got onto the pathway.
When my autism diagnosis was confirmed and the person who was assessing me said, "And you can stop masking, Kathy," I'm thinking, I don't mask. How do I mask? And I had to really unpick that. So one of the things where that I can, most people fear walking into a room of unknown people on their own. And I would walk into a room of unknown people. And as a child, I'd find that devastating. As an adult, I'd walk in, hold my head up high and think nobody knows what's going on inside me. And I'm just going to appear confident. And that's masking. So one of the things I do professionally was I'd step into my social work role and I would be a really, really competent social worker, and I'd almost come back home and sort of not be that person. And that's masking. Also things like not saying when I'm feeling really anxious, or just covering up stuff. That's scripting. So one of the things I would do as a trainee psychotherapist was when I went for therapy, I would prepare what I was going to say before I went to the session, because I had this fear of getting it wrong, and I needed to say what I needed to say. All those things are masking.
Recently, I've been having a bit of a tough time with my health. I've suddenly developed leg ulcers, and most of my experience in recent times has been around that. Earlier this year, I developed a scab over the leg and pain in that leg, and it developed into cellulitis. I never actually saw a doctor with regard to that. They just kept saying send pictures. So I ended up in A&E after my leg swelled up, and I developed a huge red, angry rash. I was admitted into hospital. Unfortunately, because at the same time I happened to have COVID, although asymptomatic COVID, I ended up in a COVID ward with people who varying levels of illness, but were generally quite poorly. There were lots of machines pinging and bonging. There was lots of observations on a very, very regular basis. However, I was being treated almost as a COVID patient rather than a patient in there with cellulitis needing intravenous antibiotics. The sensory input of all this, the constant level of care, I would say, given and observations given to people, obviously for obvious reasons, in a COVID ward, but I was asymptomatic. I didn't have any problems, nothing. But they were treating me as a person with COVID, not as a person in there with cellulitis. So that was an area of anxiety building, along with the sensory input, the constant interruptions, the constant coming round, asking how you were, constant observations of your blood, of your SATs and blood pressure and stuff like that. And I was struggling. I was really, really struggling with the levels of anxiety. My wife recognized this because we were doing Zoom calls on my mobile because she wasn't allowed in because of the COVID rules. She recognized this and actually rang the sisters in the ward. Now, originally when I entered, I told them I was autistic, but there was no real kind of recognition of that. It was just a case of, oh, okay, right, fair enough. My wife mentioned that I was struggling, and their response was, well, he seems all right. Well, I am, because I mask all the time. I am very, very good at masking. Nobody would know I was autistic unless I told them. And I don't expect people to know I'm autistic because I'm so good at masking. However, if I tell them I'm autistic, I, inverted commas, expect them to treat me as somebody with autism and make certain allowances and have certain understandings about what that means. However, the people didn't seem to have that understanding or didn't make any accommodations to that. Anyway, my anxiety levels were building and building and building. My wife could recognize this. I can't recognize it in myself. I can't recognize it in myself. I have certain elements of alexithymia where I don't know my own feelings. I don't recognize the feelings within my body. And as a result, I'd reached a level where I was ready to have a meltdown. Like I said, my wife rang and the sister said, my wife said, go and have a word with the sister and see if there's anything they can do. I went to the sister and basically, sorry, this is really hard. I went to the sister because my wife had almost given me permission to speak to them. I broke down. And as you can tell, it's very hard for me even now. I was a mess. Fortunately, they had a side room and they put me in the side room instead of the ward. And after that, things were much, much better. The sensory stuff was much less. There were no machines pinging and bonging, and obviously the observations that they were doing to the rest of the people on the ward, they were only just doing it to me. So it was the number of distractions were much less. And as you saw from the reaction, that is still very raw, even though it's 6 months ago now. It's still very raw in my memory, and I find it very difficult to think back on it.
Over the years, women have told me lots of things about when they've been to their GPs. And some of the things are, you've got eye contact. So again, looking for that stereotypical presentation of eye contact. When I ask my clients, are you looking at me? They'll say to me, not really. Have you learnt how to have eye contact? Yes. And they've chosen a place on somebody's face, or they're looking just over the top of my forehead, and it looks like they're having eye contact. But if you don't ask that question, you don't know. I think the other thing that people have said is only children get diagnosed with autism and you're in your 40s. And that's just not true. So autism is a neurodevelopmental lifelong condition that means it's been there since they were born. But the presentation is very different. And as we've talked about masking and masking those traits, and women are really, really good at it. They're brilliant actresses, and they know how to mask, they know how to assimilate, and they know how to compensate for some of the traits that they know are there, but they don't want to look different. So to be told that it only is for children is so patronising. And people have told me these things and have come to therapy sessions in tears because they've not been heard. You show feelings. Yeah, well, lots of autistic people show feelings. So that whole misnomer that autistic people aren't empathic and they don't show feelings. They do show feelings, but they may not be able to express those feelings or to tell you what they're feeling. And often those feelings can be disproportionate to the event that they might there might be. So in a doctor's surgery, when something is happening and the doctor is saying something to them and they're crying, that doesn't mean that they're not able to show feelings. They're responding to something, and often that thing might be that they're also feeling very criticised as well. So they're feeling criticised because they're not being heard. They feel that they're not good enough, and they experience something called rejection sensitive dysphoria. So many of the women that I see over the years have been told, "You're not good enough. If only you could do this, you'd be so much better. If only you could talk a little bit more. If only you didn't do what you're doing." And over the years, all that criticism has built up. So anything that's then said to you that sounds or is perceived as a criticism, you're very sensitive to. So if the doctor's saying, "Oh, no, you are definitely not, but I think you might be this," and dismissing you, inevitably there'll be a reaction. And sometimes that might be a hypersensitive reaction to what's being said. So women have said to me, "I've been told I'm histrionic," because they might be in the doctor's surgery in floods of tears and having a potential meltdown, and it's been interpreted as them being histrionic. So again, it's about us listening, really carefully listening, observing, watching, interacting with the patient to find out what's going on in their world. And that, for me, this is the most crucial thing as a psychotherapist. I spend a lot of time understanding my clients' worlds, and they're all different. Because if I go with that old cliche of when you've met one person with autism, you've met one person with autism. So every one of my clients is different and everybody presents differently. There are crossovers and there are similarities, but their worlds are different, their experiences are different, their traumas are different. But one thing that they share is that they've never been heard, they've never been seen, they've been misdiagnosed, and their mental health has deteriorated as a consequence of that.
Camouflaging is also a huge issue. So many autistic people report feeling absolutely exhausted by the mental effort that every day is involved in camouflaging. And it seems very associated with burnout, and it's also been linked with suicidality. It's also important to mention late diagnosis here. A number of studies are suggesting that autistic people who were diagnosed late, i.e. not as children, have poorer mental health. These individuals have often grown up being invalidated and having very negative narratives about themselves. So feeling that they're broken, feeling that they're weird or bad or naughty or stupid. All these negative self-perceptions are very, very damaging to a person's mental health. And what often happens is that when people get diagnosed, they don't necessarily receive any post-diagnostic support, meaning that they never really get any help to unpack these these damaging stories that they hold about themselves.
I think one of the other really important things to consider is that particularly women have that need to be perfect, often need to get it right. And that has enabled them to sort of fit in a little bit, because if they think they can get it right and have that inner monologue of what they need to do, what they need to say, in the hope that nobody will notice that they're not being perfect. So the thought of going to see a GP and not giving the right answers and then being told that you're not autistic can be really discounting for them. I think the other thing is about going to see somebody and being told by them that you're not this or you're not that, and not having that confidence to challenge, because you've been told that you don't challenge medical professionals, and they're not really being heard, and feeling so dissatisfied when you come out that they've not heard what you've got to say. And actually, maybe you didn't put on the best show that you could. Perhaps you could have been a bit more autistic. And I just think that dialogue that people have in their heads all the time, that when they come to see me as a therapist, they unpack. And I sit there at times and think, goodness me, I don't know how you manage on a day-to-day basis, because the world is so challenging. What's going on in your head is so difficult, and you're constantly discounting yourself. And how do you know when you're perfect? And how do you know when you've reached that point for yourself when everything is okay?